first time this is happening. Really unfortunate pictures we see when it comes to the grievances raised from our health sector. But Brian, just to take you back, if you are to look at the crisis that probably is looming or is already happening, you will guide me on what's happening in the private sector when it comes to the lack of funding, the lack of payment of claims. What is the likely, impact of this, and for a viewer who's watching, a patient who's watching, how will this affect them in the coming days if nothing is done to address, for example, the NHIF arrears issues and the issues you have raised from the survey?
So the private sector has been covering the nakedness of the government for too long. We have actually really tried as a sector to make this work. We have covered the nakedness. People have taken bank loans. People have taken overdrafts. I know people have even taken full Lisa just to make sure that there are drugs in the facilities. There are people who survive on monthly overdrafts. The crisis that is coming, Safin, is that we will stop. We as private sector are going to stop, and we are not going to stop next month. We are just stopping very soon. In fact, as soon as the end of this week, we will stop. We cannot continue.
Stop what exactly?
Stop providing care under SHA. We will stop as a sector.
By the end of this week?
By the end of this week, we will stop. We cannot continue to cover the nakedness of the government and pretend that everything is normal and just go on. Look, I just said this is the 7th SHA transitional scorecard. There is nothing very different in this scorecard. I mean, we have been finding out the exact same problems since 6th of October. And every time this report comes out, we share it with the minister, we share it with the SHA authority, we send it to the PS, we send it to everyone, we even send it to the presidential advisors. I am sure these reports go as far as possible. There is really nothing that they don't know. Where we are right now, I'll paint a picture for you, Safin. We literally every single day, I get phone calls from hospital owners around Kenya. These are old people, some of them, who have been invested in this sector for 20 years, 30 years. They have gotten into diabetes. They have gotten into hypertension. Some of them have suffered strokes. Yesterday, I got a call from a university student. I don't know how they got my number. He's telling me, my mzee, this is a medical student, by the way. He said, my mzee runs a small facility somewhere in Nyamira. This is how he has taken us to school. This is how he has educated us. The portal for the university was closed yesterday. I have not paid school fees. This issue of payment to facilities is now going beyond patient care. It's now going to cripple families. It is breaking homes. It is getting people to lose their entire life savings, their entire work. And guess what?
And what percentage of health facilities are we talking about?
This is, okay, so I will tell you, I've already told you 86% of level 2s, no money. But I can tell you that all the facilities in this country, I'll give you a good example. Just go to Nairobi, anywhere around this capital city, to any of the large hospitals and go with your civil servant medical scheme, find out if you will get care. They have already suspended care. The large hospitals in this city are already suspended care. They just don't do press conferences. It is the civil servants who are going to those hospitals and being told, we don't accept civil service cover. Who has been covering that nakedness? It is the smaller level 2s, level 3s, level 4s who have continued to provide care to civil servants despite the fact that our larger brothers have already pulled off. So what we are saying is very simple. Enough of that. We are not going to take any of it. If they do not sort out the issue of NHIF arrears, and by the way, we will not even give notice. We are saying by the end of this week, we as private sector have had it. We are not going to provide. And look, they keep us telling us separate SHA from NHIF. You cannot separate SHA from NHIF. SHA inherited NHIF liabilities. It is their responsibility. Let me just explain something else, Safi. We have a situation in SHA where you have no idea who is being paid what. And the reason why this is happening, I am starting to believe it is intentional. And just to add on what Peterson was saying about the fact that literally everyone at SHA is in acting position. Literally, all the workers at SHA, they cannot even do the right thing.